So thank you for showing us sort of your approach to sort of identifying patients. What are the types of data and processes that make your model richer and more accurate as you think ahead? You already have access to a bunch of data, I would imagine, but I'm curious to see what would improve that quality and what other types of streams would make it better.
Yeah, so first and foremost, because our system is an expert system upon which AI runs, it runs a little differently than like an open-ended AI system. So it's the example I use is kind of like mapping or navigation. So if you ask an AI system to find how do I get from here to there, and it doesn't know what the actual street layout is, it's going to come up with some kind of confusing and unclear answers. And so what we look at first is what is known in the peer review evidence-based literature between the associations of risks and diseases. And that forms the topology of the model. And so then the AI that is running can only run on top of that topology and make alterations to its recommendations based upon that. So it's kind of like navigation on a street map. So first and foremost, we're constantly looking at the literature and improving that model based upon new evidence-based studies that are coming out literally daily. And then second, we are running a variety of artificial intelligence and machine learning tools at site, at each one of the customer site, that is comparing what they're learning to the actual peer-reviewed literature. And so each time that does that, the model gets richer and specific to that particular individual site.